Good evening, guys. Today we are talking about first aid for lower extremities. So just content I'm giving. Okay. So mainly what are the awareness you can read. Okay. So for lower extremities trauma, what are the trauma will happen means rib fracture, dislocation, femur fracture, patella fracture, knee locations, tibia, then ankle fractures. So if fracture anything happen, that area will be swelling will be there, redness will be there. Sometimes the bone dislocation will be there. So we can find that one. So if fracture 5 it will come. Okay. So that one dislocation, femoral head fracture, then femoral neck fractures, intracontric fracture, subtrocontric fractures. So normally 250,000 people's hip fracture will be there affect. Then mainly risk factors for poor balance vision, osteoporosis, inactivities, elder people, medication, malnutrition. So hip dislocation. So here the picture is seeing okay hip dislocation for maybe motor vehicle accident, that time and all it will be happen. So it's a hip flexion or hip internally rotated or adapted. So in anterior means limb flexion, external rotation, abduction. Maybe abduction, adduction everyone knows, right? So abduction means inside, adduction means outside. Okay. So emergency treatment means close reduction and dislocated to hip on. So whenever fracture will happen, we don't want to move, we don't do that movements. Okay. It will be placed for immobilize. So goal for reduce the risk of vascular necrosis and degenerative joint disease. Allow the restoration of the follow through the occluded compressed vessels. If blood flow will be there, we can give compressed. So literally support to either yearly reductions. Then require proper anesthesia and require team. Okay. Then what are the closed reduction means, that is for emergency treatment. So the general anesthesia we can give, muscle relaxations and facilities of reductions, but not necessary. Conscious sedation is acceptable. Attempt to reduction in inadequate analgesia and will unnecessary pain to reduce. Then hip then Haley's maneuver. Haley's maneuver means the image you can see. Okay. So assistant stabilize the pelvis with pressure of anterior and superior iliac spine. Mainly this one under will do orthodox and physiotherapists and all. Okay. So surgeon stands on stretchers and gently flex the hip and gauge. Apply the progressive increase the traction to the extremity with the gentle adduction and internal rotation. So the reduction can be seen felt. Okay. So here check the stability of hip. Okay. Then repeat X-ray for pelvics and chest view of pelvics. Then CT scan. Then remain body fragment and indication of remove the incorrect fragment bones. Okay. So then femoral head fracture. It's a concurrent with hip dislocation due to cheer injuries. So here you can see main cheer means it's a pumpkin classification is there. So we that image we can identify. Okay, fracture in inferior fossa, then fracture superior fossa, then femoral head acetabulum fracture, then femoral head, femoral neck fractures. That image we can understand. Then this is normal content I'm giving. Okay, which is the main I'm telling. Okay. So treatment option type 1 is non-operative and non-displaced. ORS means open rejection internal fractions we can do. Then both fracture we can do. Then hemorrhotherapy plastics. So hemorrhoarthroplasty means I can show that image. Okay. So here femoral neck. Right. This is that middle one is hemioarthroplastic. That middle they will put the some factory retraction something they will placed. Okay, that is the hemiotherapy, hemioarthroplastic. Okay. Then what are the treatments? Is non-operate, very limited role, activity modification, skeletal tractions. Then ORFF, hemiotherapy, total replacement. So this is open reductions internal frictions, that is hemoorthoplasty, that is the total hip replacement. So next, femoral neck fractures. Femoral neck, young patient it will occur in less than 6 hours we can do. So it's higher risk for elder patients. Then intracontric hip flexions means that is extra capillary femoral neck. So image you can see that inferior border to lesser trochanter. Okay, that trochanteric femoral fracture. What will be there means it will be fixed to the hip bone. So femoral we are telling no, always telling that femoral. So that femoral fixed with the iliac fossa. So it will be if no fixation means that time they will moving means they will over and all they will do. So we can check the cross table lateral anterior and posterior we can chase. Intratrochanteric hip flexion means stable, unstable, and reverse obliquity. So here treatment means dynamic hip curve. Okay, that two curve they will placed. Okay, so intramedullary recoin. So here what will means that iliac bone that fossa will mean it's not attached mean they will put for 7 type instrument. Okay, subtrochanteric femoral means that located from the 5 centimeter LT, it distant to the shaft. This is so here intactoflimary fossa means that image you can see here that curved area little pulled inside. So that one is for intact fibrous fossa. So here what treatment means intramedullary nail they will go and do then cephalomedullary IM they will know open and reduction they will do knee dislocations. Highly association of injuries ligamentous injuries. So anterior surstate ligament, otherwise posterior circulate ligament, posterior lateral corner, and lateral collateral ligament and medial collateral ligament they will do. Okay, injuries and all will happen. So that MCL and all mainly athletics they will happen. Okay, so sometimes just ligament tear and all will be there. Then vascular injuries, it's initial tear and distributions. So here arteriogram they will placed. So arterium is heparin and everything they will for don't clot for blood, and vascular surgery consult with them repair of 8 hours. Then patella fracture means mainly it will happen for motor vehicle accidents and fall into the knee and some electric loading. Okay, so here what are the examination ability to perform the straight leg, raise the against gravity, then pain, swelling, contusions, laceration, and oppression of the site of the injuries. So here radiography what AP and lateral will take and ORF they will do, and non-operative treatment is brace and exam mechanism remain they will take. Tibia platar fracture means X-ray, the lateral traction film, the CT scan they will done. So tibial flatter they will open reduction they will keep. So appropriate temporary stabilization allow the resolution of the soft tissue and injuries. So tibial flatter fractures what are the ORF or the open reduction treatment they will do. So here soft fracture means can occur lower energy and torsion type of example skin more common with higher energy direct force, and open fracture of tibia more than any other long bone they will happen. Okay, so here associated injuries tetanus antibiotics, then the tunnel the complication is non-union, maybe it's not will be connect, and soft tissues complication will be there, and potential amputation will be there. So here and all this is for I told na prefium fossa, it's a middle some depth they will go on. So see here that bend here that bone is come out. This is for cephalomedullary. So it's a 7 type instrument they're placed. Here intramedullary nail means there is a 2 screw they're used. Okay, so this is for external ORF. They will go keep for just bone adapted because of in straight bone they cutted, so it will be just attached. Thank you guys.